We have to love our hearts, protection, and sustainability. Some background information about me. Red Cross, on the picture to the left, this is at an event, a Red Cross blood drive that I organized at my local library. And on the right, it's a picture of me at a swim meet. I'm the team captain for the 2021 school year. And something related to cardiology that I want to introduce is heart health and essentially sports medicine, because health and medicine is directly related and correlated to performance in the pool. So my spearheaded focus. My spearheaded focus lies along the lines of the causes of chronic illnesses aligned with how the environment, genetic/biological, and lifestyle affect risk level. And to the picture of the right, it essentially shows the different components and factors that are used to assess a chronic illness risk. So a quick activity. I want everyone that's watching this video to pause the video right here and try to find your pulse. And to those of you who do not know how to find their pulse, it's pretty easy and simple. You just find your pulse. It's either on your neck or on your wrist, and you count your heartbeat for 30 seconds and then double it. That special number, that magic number, tells us about hypertension, hypotension, and atrial fibrillation. So global health. From a global health perspective, COVID-19 in the past 2 years has been the major mortality causer. But as research predicts by the American Heart Association, heart disease will be the main mortality killer in 2022, right after COVID-19 trends start to decrease as they are right now. According to the CDC, heart disease is the leading cause of death in the United States, causing about 1 in 4 deaths. And keep in mind, this was right before COVID-19 hit. And a statistic that I thought was pretty alarming was that every 36 seconds, someone dies due to a cardiovascular illness. So if this presentation has gone on for 3 minutes, around 6 people have died so far. And from a global platform or stage, a total of 26 million victims are subject to cardiovascular illnesses. And keep in mind, these victims are not evenly distributed around the world. They are located in hotspots, depending on culture and country. So on the picture to the right, it depicts a type of heart disease, which is ischemic heart disease. And as you can see, this type of heart disease is mainly concentrated in China, in United States, which is not shown on this graph because it's not up to date, and Europe and Africa, but Africa is starting to decrease. So some statistics: biological, social, and economical. Cardiovascular Medicare, or insurance from cardiovascular illnesses, has reduced from 14% to 11%, meaning victims or patients of cardiovascular illnesses are not receiving as much money or insurance for the procedures. Another alarming statistic is that there's higher rates of adolescent heart risk, which is assessed from a Stanford study at a local hospital. So Stanford took over 1,000 adolescents that were admitted to the hospital, and a majority of them showed early and incoming symptoms and signs of cardiovascular illness, such as elevated levels of cholesterol, elevated blood pressure, and elevated lipid level. And an alarming statistic that I found was that more than half of those who develop coronary heart failure die within 5 years of diagnosis. And another facet is economic irony. So essentially, in wealthy countries such as the United States and Europe, they have higher rates of heart disease and cardiovascular illness, which is a type of irony because these types of countries tend to have the most available funds and most initiatives for healthy eating and public safety. So again, money does not equal health. And on the graph to the right, it essentially shows the different ethnicities and cultures of coronary heart disease in the world. And even though the trends are decreasing in 2022, trends predict that it will increase from the decrease of COVID-19 and the increase of more dietary habits and vaping. So the 3 types of heart disease are coronary heart disease, also known as CAD, rheumatic heart disease, and myocardial infarction, also known as heart disease. Coronary heart disease make up 55.6% of cases and are most distinguished by the artery blockage. You've probably heard people saying how after eating high amounts of high-fat foods, such as fries, that they feel like their arteries are blocked. And essentially, that's what causes CAD. And most research in this type of heart disease is done in Duke and in the Imperial College of London, with one project being shown later in the presentation. And a prevalent demographic for this CAD is white men and Asian American men, not only because their culture has higher fat foods, but also men are more subject to blood pressure and anger issues, which again is not confirmed nor denied to be a cause of coronary heart disease. Another type of heart disease is rheumatic heart disease with a 51% mortality rate. It's an inflammatory disease in connective tissues, meaning it does not start in your arteries or heart, but instead starts at your legs and then transitions to your heart. Another type of heart disease, also known as heart attacks, is another prevalent issue in the world. And there's three types. It's either your heart stops, your heart slows down, or your heart speeds up. And one in five of these cases, or 20%, are silent, meaning the victim does not know these are happening. And on the graph to the right, essentially is a more specific distribution of the different countries and how different countries have different percentages and different demographics of heart disease. So an economic influence, can a global effort be made in the long run? And to be honest, the outlook is looking pretty grim. 43% of families that have CAD or heart disease need financial assistance, which is a major turnoff for surgery. Again, the government and the world cannot fund major surgery operations or surgical operations for cardiovascular illnesses, not only because they're expensive, but we simply don't have the money. And like I said before, Medicare is not providing as much insurance and help for these operations. Another social or economic type of socioeconomic effort is wealthy nations can sponsor free healthy meal initiatives. And again, this shows the uneven distribution of wealth between the world because countries such as the US and Europe can fund healthy eating initiatives. So again, a global effort can't really be made unless these countries work together somehow. Prevention and limitation. The three types of prevention strategies are dietary changes, ending tobacco or vaping, and medications. Again, all three of these strategies have their limitation, but they are the most prevalent and the most useful because again, global effort is not a viable solution. So again, it has to start straight from the home, prevention. Dietary changes, again, geographic access and food deserts. Again, ending tobacco is hard because it's addictive and medications are available such as carvedilol and bisoprolol. But again, these are expensive and Medicare especially cannot completely fund these. And again, mental health such as stress, like I mentioned in the demographic, is important in prevention because low levels of stress can reduce the risk of heart disease. The overlap of technology. So in recent years, technology has become a major influence in preventing and understanding where cardiovascular illnesses stem from and how heart disease can be prevented and how these strategies can be used in other chronic illnesses. So the major study that's being done is how to predict heart attacks based on cholesterol, blood pressure, and heart rates. And Apple is said to be a major contributor in this study because using Apple Watches and the health app, they can track your blood pressure and your heart rate. And these can be used as a calculator and essentially be used in predicting heart attacks later in the future. Another strategy or technology overlap is clearing arteries with tiny robots for CAD. So on this picture right here, these robots will be sent into arteries and use sound in order to transport and move the lipid concentrations and fat deposits in your arteries to allow blood to flow well again. Another technology calculation is heart risk calculators developed by the World Health Organization and PAHL. And again, just like Apple, you have to input what your blood pressure, whether you have diabetes, cholesterol, et cetera, and it'll tell you your risk for heart disease. So some major takeaways from the presentation are, again, a global health initiative is unlikely and unseemingly to be the solution to our heart disease in the future because again, it's not feasible. And the three major takeaways are 3 Ps, overlap with other fields, and cultural differences. As I mentioned, cultural differences such as the food we eat, genetics, body structure, all play a role, whether it be major or minor, in calculating heart risk. And again, heart overlap with other fields such as technology. And again, this field is also overlapping into the social field of advocacy because in initiatives such as the Healthy Meals Act for kids in school, heart risk is being used as sort of a leeway because organizations such as the AHA are using heart disease as a major factor in their studies. And another takeaway is 3 Ps, prevention. Heart disease can be prevented by dietary changes, from lifestyle changes, and from medication changes. Potential in 2022, as I mentioned, heart disease will be the major mortality rate and causer right after COVID-19. And again, prevalence, heart disease is one of the most prevalent, as I mentioned in the graph below. So these are my references and these are my contact information.